What area of that spine is the most common that you see?
Most commonly
with pain?
Most commonly affected will be the last two levels, either the L4, L5, or the L5S1. So those are the ones that normally get affected the most. Why? Around 75% of the mobility of the spine comes out from the L5S1 level, and about 15% comes out from the L4-5 level. So those are normally there's a lot of more wear and tear, and the people they might get more, since they're moving around, they're doing some activities. Those are levels that they can get compromised, and they can get affected and become more painful.
And is that age-related, doctor? Is it genetic? Could it be a combination of both? Because you'll see some people in their 80s that are perfectly fine, and then you see some people that are in a lot of pain. So is it both factors?
Both are factors. The most common one will be age-related. As we age, normally the constant wear and tear, those they can degenerate, and that can cause you symptoms. And also genetic also can play a role factor there. We know that from statistics that over 90% of patients over the age of 60, they will have degenerative changes already on the spine. But that doesn't mean because you might have some changes from arthritis already on the spine, that doesn't translate that you have to have symptoms. It will depend on what you have done over life and the wear and tear, and also some genetic component.
Okay, one last question before you come join us. And weight, being overweight, is that a factor too?
Definitely a factor. The more overweight the patient is, normally the center of gravity is passing through the spine here. So the more overweight is, the center of gravity shifts away from the spine. The more torque you put into the spine, the more likely that you can degenerate the elements in the lower back.